For most women, after having babies, the midsection doesn't just bounce back. And when you lose significant amount of weight, the fat goes away, but the skin it was in just sags. The latest procedure can get you the flat tummy you've been wanting, and the recovery is easier. I'll take that under the Christmas tree anytime. Joining us is board-certified plastic surgeon Dr. Abigail Rodriguez from the Aesthetic Center for Plastic Surgery. Also joining us is Wendy Pell from ACPS Medspa to share how they can help minimize any scarring. Good morning.
Good morning.
All right, Dr. Rodriguez, you are birthed from two parents who are OBGYNs. You decided to take the next step in medicine and say, I'm going to deal with what happens after you have those children.
Exactly. It worked out great that way.
Yeah, right? Okay, so your specialty is drainless tummy tucks, which if people had the tummy tucks in the past, they realize when they leave surgery or leave the OR room with all these little things to drain off into, right? And then you do breast surgery, and you're known for stitching and clean lines, which is so important.
Well, I appreciate you saying that. And, you know, as a plastic surgeon, we really take pride in how our scars look. Yeah. Obviously, there's a lot of things we can do afterwards with lasers and things like that, but it really starts in the operating room, being precise with closing the incision. So I always do my best with that, for sure.
Always part of that process. All right. And Wendy, you've been practicing since 1995. You grew up loving the sun, but the sun, as we know, eventually does not love us back. But that got you interested in skin and how to get the best skin you can.
Absolutely, yeah. Because when I first moved here, I was a sun worshiper. I loved the sun. If it was out, I was out. And then once I started doing skincare, I was like, oh, so this is what I should be doing.
Yeah, or no, this is what I should have been doing.
Yes,
but the good thing now is that you have a whole line of things that can correct the damage that was done. You became an esthetician, which is someone who deals with great skin, right?
Yes,
but you're also licensed as a massage therapist because massaging, especially after therapy sometimes, or after surgery, can be important.
Absolutely, yes.
All right, the tummy tuck. It's not just removing excess skin, because sometimes people will stand in the mirror and go, if I could just get rid of this right here. When you're pregnant, in particular, the muscles have distended, right? And they don't necessarily go back. So even if you're thin, you could have that bulge. So a tummy tuck can even be done on a thinner person. Oh,
absolutely. And I think a lot of times the most dramatic results are actually in thinner patients, that because of the muscle separation that you're talking about, it's sort of preventing them from strengthening their core how they want to with exercise and getting a flatter stomach, despite good, being at a good weight and exercising, all that kind of stuff. So it's a great option for that kind of person.
But can you explain something to me? Like, I have a friend who had 3 kids, and her tummy is flat as a board. I just had one, and it was a wrecking ball. Like, what is that? I guess, is that DNA, or what is that there?
Honestly, it really is. There's so many factors, and a lot of them we don't really have control over. So genetics is a huge component of it, for sure.
Okay.
So that weight fluctuations, how many pregnancies you had, how large your babies were.
Yeah, like I said, she had 3. I only had 1, but mine was 9'5". Okay, maybe that had something to do with it. All right, drainless versus the regular tummy tuck. So for someone who had or have seen somebody go through the prior tummy tuck, give us the difference.
Right, so traditionally a surgeon will place a drain, which is like a thin tube that is placed under the skin, exiting the incision, and has a little bulb that collects fluid and blood that drains out. And I've cared for a family member that had one of those after a surgery, and honestly, it's very cumbersome, it's bothersome, so to be able to do it without doing a drainless tummy tuck is fantastic. So instead of placing a drain, we just place extra stitches on the inside to seal down the space and eliminate the need for that.
Yeah, all right. Usually what is the recovery on that? Because it is surgery.
Oh, absolutely. But I think nowadays we have so many wonderful kind of advanced techniques and medications that really help speed it up. So I usually tell my patients by a week after surgery, you're safe to drive as long as you're not taking any strong pain medicine. And for most people, they can go back to work 2 weeks afterwards.
Yeah. And one thing we want to make clear, that this is not a way to lose weight. This is a way to contour after you've gotten to your pretty much close to your goal weight, right?
Yes, that's an excellent point. It's not a weight loss surgery. On the contrary, you want to be at your goal weight before, and it's really to make sure that the visceral fat, or the fat on the inside of the abdomen below the muscles, is reduced so that we can really make it as flat as possible for you.
Yeah, all right. Who is a great candidate for this?
So anybody that's finished having children, it's best to wait until after you're done so that you don't undo some of the benefits or the results of the tummy tuck. And again, at your goal weight, healthy, keeping up to date with your labs and visiting your doctor, all those things are important.
All right. Should you get into my tummy and you look at it and you go, could I get a six-pack if I was wanting one?
Well, honestly, you know, the sutures that I place instead of using that drain really help to create some definition along the midline in the middle, so you have that little kind of lean, athletic look. So we can create some of that, but absolutely, you know, how you've kind of exercised and taken care of your body will play a role in that.
I'm having a fantasy in my mind right now, everybody, in case you haven't figured that out. All right, so obviously post-op is very important with you, and that's one of the things where the spa as well plays an important role. So the tummy tuck scar, it can, like you said, you place it low so you can still wear a bikini. We're looking at right now, you can't see the scar, and you do the most to go ahead and make sure it heals where you don't see it as much. But there's extra things that you all are doing that can help with that.
Yes, and that's where Wendy comes in.
Yeah, so we have different, depending upon what the scar looks like. If it's red, we have what's called a BBL photofacial that targets the red in the scar. And then if it's pigmented, we have different lasers, Fraxel, Halo, that'll also help with the pigmentation in the scar.
Yeah.
And a lot of times you have to pre-treat it first to help control the melanocytes in our skin for the pigmentation. But
so that's for the tummy tuck, but you all will treat all kinds of scarring. We talked about hyperpigmentation. I know the darker the skin is, usually you can get just a little cut or something and it's a dark, and I've dealt with that. You treat hyperpigmentation, but things from people if they've had surgeries before, kind of trauma to the skin before, and you are a perfect example of that. I see a light red mark right below your neck and above your chest right there. Tell us what that is.
So I had
in fact, we're looking at what it looked like before.
I've had parathyroid surgery the end of August. So I told my surgeon, make sure you sew the scar nice, but if not, I have the tools to treat it. So I've done 3 photofacial treatments for the red, and then I've also used a product called Elastin Reform and Repair. So that has also helped with the redness and the big mound of scar tissue that I had. It helped break that up as well.
Yeah, because sometimes you can get rid of the coloring, but then you have this big, like massive scar tissue, as you said. That's amazing. My mother had that surgery, and so I remember the scar that she had, but it looks amazing right there.
Yeah,
so.
I'm very happy, and it's just a lot of times it's a combination of treatments. So I only needed the BBLs and then the Reform and Repair. I'm still using it today just to help a little more with it.
Because a lot of times, you know, there are people who wear their scars proudly, but other times it reminds them of what they went through, and they just wanted to make it look like it was. All right, Dr. Rodriguez, there are so many things when people come in to see you. We talked about, you know, tummy tuck in particular, but if you want facelifts, breast lifts, body lifts, eyelid lifts, facial rejuvenation, labiaplasty, breast augmentation, injectables, all that type of stuff, just come in. If you say, this is what I'm noticing that I don't like, whether it's genetics, whether it's something that happened because of trauma, or you just want to go back 20 years or whatever, right? Whatever it is, sit down and talk with you, have a consultation with you. Sometimes you can help people kind of bridge the gap before they need to show up in her office, right?
Yeah,
precisely.
So just talk to you, and you have them point out things that they don't like, and then you can point out things that can improve it.
Yes, absolutely.
Okay, last thing. When you go to the holiday cocktail parties, do you stare at people? Like when they're talking to you, you're sitting going, "Hi, Megan, how are you? How's that?"
No, I try not to do that.
Okay, thank you, ladies. Dr. Rodriguez is offering a special promotion right now. Receive a free consultation and $1,000 off a tummy tuck until January 31st. You must mention Great Day Houston when booking to take advantage of this special offer. To book a consultation, give them a call at 713-799-9999. Again, the number is 713-799-9999, or you can visit their website at drrodriguez.com and see some more before and afters. To book an appointment with the ACPS Medspa to address scars or other procedures to improve the skin you're in, visit mybeautifulbody.com.